Hello, I'm Dr. Ben Marble. Welcome back to our channel. It's been a little bit of a hiatus between the last time that we talked and now, but I'm back on the horse. So I wanted to let you know that if you like what you see, as always, give us a like and hit subscribe. But we had a question came in the other day, talked about, hey, Dr. Marble, you talk about doing procedures and even doing stuff in the office. Tell us more about that. So I have set up our medical assistant actually, she helped us put together what a common procedure would look like, the things that we need for this upcoming procedure that we're actually going to be doing this afternoon. And so what I will do is I'll walk you through what our setup is like. And oftentimes some of these minor procedures like fixing a bunion, or fixing a hammer toe, or sometimes the toe is not healthy and just the patient's decided that they just don't want to have the toe there anymore. So we do those procedures here in the office, and they're a 45-minute appointment essentially. And we set up and get everything ready. And so without further ado, let's go right into what our setup looks like. So first things first, when the patient comes into the office and back into the reception, into the treatment room, the surgical suite, we shall call it. That's where we're at right now. But what we do first is we numb up the patient, and so we do have local anesthetic that we use to numb up that part of the foot. Sometimes it can be anywhere from 5 to 10 to 15 cc's of an anesthetic that we do, and we use some cold spray that kind of shocks the skin from feeling the poke and helps the patient to tolerate the injection well. And then after they're done with that, after they're going through the numbing process, of course they've already signed the consent form for the procedure. Then we go through and our medical assistant scrubs the patient, and we either use that kind of scrub or we use something called either betadine or this, which is ChloraPrep. And then after everything's washed up, then we go ahead and put we put a drape on, and then the doctor. Well, first of all, either myself or one of the doctors here at Pueblo Ankle and Foot Care, we get our gown on with our sterile gloves, and then we put the drape on the patient. And then after that, then we have all of the sterile instruments. We put that onto a sterile back table or sterile mail stand, and we get everything prepared that way. These are some of the types of instruments that we use, anything from a rongeur to a bone cutter to this is a grasping instrument called a needle holder that we use as well to literally sew the patient back up after we're done. And again, the entire time, patient doesn't require any kind of anesthetic, like general anesthetic. We did the local anesthesia, and so we don't really need to do any additional general because it's all localized to the foot. And then what we do, we verify as well that there's not been any bleeding vessels or anything. This is a cautery, just a handheld cautery that has limited uses that we carry here in the office. And then here's of course our suture to suture the patient back up. So we have all of our dressing supplies here, anywhere from like something called Coban to an ACE wrap. All of these things are important as far as after the procedure is done, to send the patient home, and also with a post-operative shoe in their newly dressed foot, newly surgical dressed foot, and then we send them home with some post-operative instructions as well to making sure that they're behaving themselves at home, giving them all the commonly asked questions. Incidentally, before they come to their procedure, they receive an in-office instruction sheet as well, or an in-office pre-operative instruction sheet, things that they've done to prepare to come as well. Things like doing some washing that day, making sure they bring some pillows with them for the ride back home to keep their foot elevated, stuff like that. So that was a lot. I know I just gave you a ton just now as far as what a typical surgery looks like. If you have any comments or questions, please put those in the comments section. Look forward to engaging with you. Have a wonderful day.